Hello, my name is Elin, and I'm the founder behind Scala. To start off, how much do you weigh? I'm not actually asking, but if I were to ask, you could probably give me a reasonable estimate or step onto a $15 scale from Target to find out. The actions that a wheelchair user must take look very different. The average cost for a weighing scale for people with mobility impairments is over $2,000. Wheelchairs can be anywhere from 20 to 200 pounds, and so the load-bearing requirements make this product very expensive. If someone doesn't live with a caretaker, they must use public transportation to go to a physician's office, which is relatively difficult. Not knowing your weight is more than an inconvenience. There are over 1.4 million patients affected by dosage errors related to medication prescription each year. This leads to over 91,000 cases that cause significant patient harm that require additional hospital stay. All of this leads to $760 million in expenses in the US healthcare industry related to medication prescription and administration each year. My solution is Scala, a folding wheelchair scale that allows people to weigh themselves in an affordable manner in their home. It's designed to unfold to allow ambulatory wheelchair users to weigh themselves and transition off of their wheelchair. At the start of my design process, I looked at incorporating a scale into the daily lives of an average user, incorporating load cells into existing modified shower benches or toilets, but given the wiring and mechanical concerns, the earlier ideas were more impractical. I went for a straightforward solution, a seated weighing scale following ADA requirements and recommendations for the height and size of this product category. Scala uses plywood pieces and polypropylene joinery with strain gauge load cells in the feet of the chair to measure someone's weight. There is a digital display that allows people to instantly see their weight and a corresponding mobile app that allows someone to track their health and see if there are any adverse side effects to medication or undiagnosed medical issues affecting their weight. The target base for this customer is over 19.8 million adults in the US. This number is expected to grow as we see a rise in prevalence in chronic diseases related to aging. The UK and Sweden currently drive innovation regarding elder care products, but the global rehabilitation equipment market is valued at over $20.1 billion. Current products are outdated and expensive. The most common one are just giant steel platforms, and the current seated scale is still over $700. So as I mentioned before, the total user base is 19.8 million people, and this can be further segmented into bariatric, geriatric, and paraplegic people. So indirect customers would be care programs that target these specific user groups, such as comprehensive care programs that help people lose weight to qualify for bariatric surgery, providers that work with Medicaid to offer care for older adults, as well as veteran support systems for paraplegic people. So to map out the stakeholders, the end users will be everyone with mobility impairments, and influencers will be healthcare providers specific to these people, and decision makers will be the end users themselves, as well as retail superstores and nursing home communities. The distribution channel will follow a direct e-commerce site that allows people to buy directly from the website, as well as selling with hospital healthcare facilities and partnerships with retail stores. Scala is priced to be at $180, and it costs $120 to make per unit. This price is expected to decrease to $80 per unit once it's manufactured at a bulk scale. It can be priced higher and still be competitive, but the other end is that most people are not willing to pay over $200 for a product that's non-emergency. To give some background, I'm a student studying industrial design, and I'm trying to define my own design philosophy as I enter the workforce. I believe that design can be leveraged to better the human condition, and I want to design for a world that I can age into independently and gracefully. So these are my next steps. Do you guys have any questions?
All right, judges.
I wonder if you could tell us a little bit about the work you've done on the distribution of competitive products, because the ones that sell for $800 don't cost $600 to make. They cost a heck of a lot less. And then along the way, it's marked up, and the medical business is really a mess in terms of kickbacks and getting paid for checking boxes and so forth. And you have to fit into that. And I just wonder what you've explored there.
Most of the distribution research I've done have been primarily in the rehabilitative space, and the development for these type of products are primarily funded through research because it's not as profitable in the short term. And so most of the products that I've seen come to market are through veteran support systems, and then they are distributed slowly through healthcare facilities that ultimately are not accessible to the end user.
Paul?
Thanks for sharing the very nice idea. Whenever I look at something, if I'm trying to get into a business, I look at how much the existing thing costs, and I try to figure out why does it cost that much? Because if there's a good business opportunity, someone else must have come in. Why do you think it costs 758? Like, what's your theory of why can they get away with charging 758 without someone like you coming in and competing?
I think because of the licensing and requirements needed to clear all the FDA requirements, innovation within the healthcare sector is slower. And so it takes time to make a product that is more consumer friendly and not designed only to fit within a healthcare facility.
I'll ask a follow-up question. I'll ask a follow-up question, which is when I buy my bathroom scale, I don't think it's cleared by, I buy it from Target. So I guess my question is, do you see your product fitting in a space where you definitely need I don't have there's no right or wrong answer to this. I'm just trying to understand what your business model is. Are you trying to run something where you could potentially just do a sale, like, selling a scale at Target, or are you actually trying to run a business strategy where you're going to go through all those regulatory loopholes? And there's no right or wrong answer. I just want to know what you're thinking.
The goal is to make the product as accessible as possible and end up as like a consumer product that can be used in the store. Unfortunately, because of the consumer base, having it within directly to consumer in the beginning is going to be more expensive. And so working within healthcare facilities in the beginning would be more viable in the beginning stages.
Sorry. Fantastic idea. Have you spent any time talking to anyone in terms of just like customer discovery at an individual level or at an organization level?
At the start of this project, I worked with a paraplegic researcher, and so he gave really valuable feedback on the realities of his day-to-day and the work that he does in relation to rehabilitative equipment. And so I worked with an occupational therapist that also gave feedback on like what the realities of like the average tasks of a user would be. But in terms of outreach with customers, I have not done as much discovery yet.
I have a question to follow up on maybe all three questions. I believe I heard you say you could sell this for X. What did you say you could sell it for, you thought?
180.
And how much did it cost?
120 to make one unit without any bulk purchasing.
Because that seems to me like it's a very small margin for a manufacturer. Have you thought about that? And have you thought about how, given that kind of margin, if you want to call it, you would pay for all the other expenses of getting this sold?
Yes, it can be priced higher, but there was a Statista study, I think in 2023, that showed over 70% of the people were not willing to pay for non-emergency equipment that was more than $200. And so increasing the price would make this product a lot less attractive for someone that cannot afford the product. So at a certain point, I think the economic concerns overshadow the health concerns in the long term.
All right, so then I think I heard Poe ask a question before. Have you investigated whether you can produce it for less money?
At a manufacturing scale, at a larger scale, it would be because making molds for the joinery gets cheaper over time once it's made in the initial fabrication process.
Great. Thank you so much, Elin.